Hi, I'm Chris Scanlan. I'm the college tutor for Anaesthetics in the Trust. Right, so I think the first question I've been asked is about why did I choose Anaesthetics? I don't know if I chose it specifically or whether it kind of chose me. I trained in Wales and did what was then just 1 year house jobs in kind of medicine surgery. Enjoyed both of them, but liked probably the medical side of things more. But also I think liked the kind of dealing with the more sort of intensive care, critical care type aspects of general medicine even back then. I then, after that, because I really hadn't decided what I wanted to do, I went and worked in Stoke-on-Trent doing paediatrics for a year and did a year of neonatal, or did 6 months of neonatal intensive care and then a year of general acute paediatrics, but in quite a large unit that's also got paediatric intensive care. So although I never did actual intensive care paediatric work, we had a lot of teaching from a lot of paediatric intensivists who taught me things that are still useful today for my intensive care kind of career. I think doing that made me realise that I actually liked the intensive care side of it, but that, as I once said, paediatrics is a lovely place to visit, but I wouldn't want to live there. It comes with its own stresses, and certainly the paediatric intensive care consultants then needed to basically live on their intensive care unit. So I decided to do anaesthetics with a view to sort of being an adult intensive care consultant. I then moved back to Wales and did my first core years in a place called Abergavenny, which is sort of north of Newport, and a lovely part of the world, nice place to work. Learnt a lot, learnt how to give an anaesthetic, learnt a lot about intensive care medicine. And then because I realised that I definitely want to do intensive care medicine, you also have to do some medicine. So at that time there was another, if you like, a second core rotation in Bristol where you did, again, adult medicine and intensive care and anaesthetics. So in all I would have spent, after what would now be considered foundation years, I spent 3.5 years in what would now be considered core years before I got a registrar number. And I originally got a registrar number in Bristol, and because we then had a family and my wife's from Hastings, that's why I moved down to this part of the world and carried on my anaesthetic registrar training in Brighton with some time in London. So that's kind of my, if you like, my career journey. I think over the years, there's always a choice with anaesthetics about whether you do just anaesthetics, whether you do one of the other subspecialities, like we're involved with chronic pain, there are people involved with pre-hospital medicine, or intensive care. Intensive care, I suppose I should point out at this time, intensive care is is mostly the domain of anaesthetists, but there is a separate faculty of intensive care medicine now, and you can enter intensive care registrar training now from a medical background, an A&E background, or an anaesthetic background. You can enter it from those points. You can train just as an intensive care consultant, or you can train as an intensive care consultant with a dual training program. So you can be both an A&E consultant and an intensive care consultant, an anaesthetist intensivist like I am, or an acute medicine consultant and intensivist. You can also do respiratory and renal as dual specialities as a consultant. It is fair to say nationally most anaesthetists, most intensivists are still also anaesthetists, but there are a growing number coming from the other routes into it. So if you're thinking about intensive care, I still recommend it as a career. It's obviously had a busy year this year. It's always varied. You know, from year to year, from week to week, there's always different stuff. It's one of the last few general specialities in that we deal with people from medicine, people post-surgically. In a smaller hospital, we have to deal with children, we deal with frail elderly people. It's a big, wide general speciality, and so you meet everybody in the hospital. I think I know people from every department, from surgery, radiology, obs and gynae. We deal with them all. Anaesthetics is quite a good complement to it in that respect, and so anaesthetics for me is like the balance to my intensive care. In the anaesthetics, whereas intensive care is often a very complicated, difficult to control, sometimes quite stressful environment, but challenging and therefore quite rewarding to do. Anaesthetics is much more about precision, about managing an individual one thing at a time. You can only do kind of one thing at once, so it's much more controlled. So they complement each other quite well as a kind of a work thing. I suppose I should talk about work-life balance at this point. I mentioned right at the start, when I did medicine and surgery, I think I preferred medicine over surgery. I think some of my decision-making around that is there's very much the sense that surgeons take their work home with them more. They still very much own a cohort of patients, and regardless of what time of day or night it is or where they are in the world, there is a degree of responsibility that attaches to it. Anaesthetics intensive care has moved in a different model in that we very much have a team approach to handing over patient care, so we're very much session-based, and I guess that's why it complements well with acute medicine and A&E, which are also very sessional, that we will turn up, we will do our session, and then once that period of time is over, we will hand it on to another colleague, and so we structure our work pattern around that idea, and that's quite important for work-life balance, and there are clearly specialities where ownership of the patient stays with you all the time, and there are other specialities which are set up to hand over care of the patient from shift to shift and from session to session, and that's something that I don't think you realise when you're very junior, that is a consideration as to what type of lifestyle you want when you're older. What else do I like about it? Like I say, it's varied. There's lots of time for training. Anaesthetics has probably got one of the best training setups in that we train our trainees on effectively one-to-one in theatres. There's lots of scope for sort of audit research. Anaesthetists are probably overrepresented in kind of management setups as well, because there is, there's good balance between your sort of clinical work, and everyone's got time in their consultant job plan for sort of administration and things like that as well. So it does lend itself to being able to get involved in the sort of more allied things of sort of audit, quality improvement, management, and teaching. I guess I'm the college tutor, so my particular thing is teaching. I've done lots and lots of simulation teaching over the years. I've done various types of life support courses and learning courses. So education's another kind of big thing that I enjoy doing, enjoy being involved with. So anaesthetics is quite a good speciality for that side of things as well, I would say. I think I said most of the things I can think of to talk about. I know there's going to be a follow-up thing where people can kind of get in contact with me, and if people are interested in a career in anaesthetics or intensive care medicine, I'm on the trust email. It's cscanlan@nhs.net, or just wander up to the anaesthetic department or the ITU and find us, and we can sort out taster weeks and things like that for people. It's certainly worth a look and a try and see if you're not undecided. It's got lots of advantages to it. I say it's interesting, it's general, you meet lots of people. That's anaesthetics and ITU.